I'm from a very rural area in upstate New York.
I am originally from New Jersey. I moved up here to be closer to the mountains. I was more in a suburban area beforehand, and then I moved to a rural area.
My first job was up in also an underserved area, but in Maine, and that was like a surgical, mostly some medical patients, like a post-op floor. And then for the last several years, I've worked in oncology at Maine Medical Center in Portland.
Started off working in Laconia on med-surg and inpatient psych. And then I worked in diabetes and endocrinology, and then I moved over to a long-term care facility specializing in dementia care.
I've done my clinicals. The first rotation was in Portland at Martins Point, and then the rest of them, one was up in Farmington, Maine, which is about 2.5 hours north of Portland. And then the last one was in another rural little clinic, like a full house center though. They have their own dental wing and mental health support and social workers. It's a really cool little center. That was an amazing experience.
It's making me think a lot more about the patients and what they need in this area and as compared to the urban area.
Spending a few years in an underserved area kind of really does a better job at honing your skills because you're seeing everything, but there you don't have access. So I found that working with those providers, like they were very resourceful and kind of they were very good themselves at the skills because there was nobody else around.
They have to drive a lot farther when they need walk-in care, urgent care, emergency care. They have to go longer distances, and there is not the amount of providers up in this area that there are down south in New Hampshire or in New York City or in Boston.
The patient population is very diversified. You have a lot of your rural need patients, and that's a good diverse area to learn in and to practice my RN in.
It will prepare you for being able to manage things on your own a lot more, which I think it gives you maybe a little more independence in that respect. So if somebody's looking for that, I think that would be a really good option. When I'm working in a rural area and knowing about the access to care and access to resources, and the things that they're encouraging people to do in the urban areas are not going to fit for patients in the rural areas.
Working in the underserved areas, the patients are so grateful and they often don't have access to healthcare. So just the short interaction with healthcare providers, they're like a sponge and they really, really want to take the time and learn everything they can.
You also have to be very flexible and creative in your care of patients. And you have to really, delve into that social history.
Patient-provider relationship is very different, I feel like, in an underserved area, where more fulfilling for me when I was working there because you're giving so much more just by the little things that we take for granted.
There are a lot less providers up here, so that means that there's a much greater need. If you're really looking to have that good relationship with somebody and develop that rapport and really make a difference, then the rural health might be definitely for you.
It's such a huge help with grants like this. It has such a huge impact on individual students.
It's been like a weight lifted, really, for the amount of student loans.
We're trying to progress our careers, but it's financially really hard to convince your families that you should keep going back to school. Things like this really make a big difference, and I really appreciate it.
I focus a little more on my studies and not on the worries of having to pay all of the money back, and really having that outreach and support from UNH and from ANEW to be able to really just focus on the clinicals and on the work that needs to be done. So that's been a really big help. So I thank you for that.
I feel ready. I mean, this is a totally different feeling than what I felt in past semesters. This semester, I just feel like I'm good.